Hi there, my name's Michelle Kenyon and I work as a consultant nurse in stem cell transplant at King's College Hospital in London. People with graft versus host disease often describe the experience as unpredictable, as exhausting, and at times overwhelming. Healthcare teams can make a profound difference by offering support that is consistent, coordinated, and compassionate across the whole pathway. I think there are 5 key elements that really matter here. Firstly, proactive and clear communication. People need graft versus host disease explained in plain, accessible language, not just once, but revisited over time as their understanding and their circumstances change. Setting realistic expectations about symptoms, flares, and recovery helps to reduce fear and uncertainty. Encouraging patients to report changes early and reassuring them that they're never bothering the team builds confidence and prevents avoidable deterioration. I think secondly for me, continuity and coordination of care. So graft versus host disease management spans transplant teams, organ-specific specialists, primary care, and also community services. Patients frequently tell us that what helps them most is having a clear point of contact, often a clinical nurse specialist or an advanced clinical practitioner who knows their story well and can help them to navigate the system. Sharing care plans across teams helps to avoid duplication and stops patients having to retell difficult experiences again and again. Thirdly, of course, I'm a nurse, so holistic, person-centered support. Graft versus host disease affects far more than the organs we measure. It impacts energy levels, mobility, mood, relationships, work, identity, and of course, daily functioning. Routine assessment of physical, psychological, social, and functional needs is essential. Early involvement of the wider MDT, psychology, physiotherapists, occupational therapy, dietetics, as well as dermatology and ophthalmology, really helps people to manage the broad and often hidden consequences of long-term graft versus host disease. Fourthly, empowerment and self-management. Well, people cope better when they understand their condition, their treatments, and what to look out for. Supporting patients to recognise triggers, monitor symptoms, and understand their medications builds a sense of control. Co-producing goals that matter to them, whether that's returning to work, getting back on with hobbies, or rebuilding confidence, helps to make care more meaningful. Written or digital resources and signposting to peer support systems helps to strengthen this further. And finally, emotional validation and trust. Living with graft versus host disease can involve uncertainty, loss, and grief for the life people expected after their transplant. As healthcare professionals, listening, believing symptoms, and acknowledging the burden of long-term treatment helps people to feel seen and understood. Being honest while maintaining hope builds trusts and supports people through the ups and downs of their recovery. Together, these elements, clear communication, continuity, holistic care, empowerment, and emotional validation, create a pathway where people feel supported, informed, and never alone in managing graft versus host disease. Thank you.